Please pay particular attention to the indication and important safety information at the end of this video. Also, please visit the official patient site for full safety and prescribing information. If your doctor or healthcare professional has prescribed ALKINDI Sprinkle, this short video will help you understand exactly how to administer the treatment. There are 3 different options for administering ALKINDI Sprinkle to a child. Firstly, babies that are limited to liquid as main source of food. Secondly, younger children who can be spoon-fed. And thirdly, older children who can self-administer. This video will show you how to administer ALKINDI Sprinkle to an older child who can self-administer. The first step is to check the expiration date on the bottle. Do not use if the expiration date on the bottle has passed. Step 2. After confirming expiration, remove the prescribed dose of ALKINDI Sprinkle capsules from the bottle for administration. Step 3. Take the capsule and hold it so that the printed text is at the top, ensuring all the granules are in the lower half of the capsule. Step 4. Gently squeeze the bottom of the capsule. Step 5. Carefully twist off the top of the capsule. Step 6. There are 3 options for administration available to you. Either pour all the granules directly onto a spoon and place in the mouth, or sprinkle the granules onto a spoonful of cold or room temperature soft food, such as yogurt or applesauce. If providing with food, make sure all granules are poured carefully onto the spoon. If you feel that the full dose is not administered, either follow your doctor's instructions or contact your healthcare provider. Or pour the granules directly into the mouth. Whichever method you use, it is important to always tap the capsule to ensure all the granules are removed. Avoid wetting the capsule on the tongue, as this may result in granules remaining in the capsule. Step 7. Finally, once the treatment has been administered, they should take a sip of fluids. This will help to ensure all the granules have been swallowed. The granules should be given and swallowed within 5 minutes to avoid a bitter taste. When administering ALKINDI Sprinkle, there are a few things that you should always remember. The granules must never be added to liquid for administration, as this can result in less than the full dose being given. It might also leave a bitter taste in the mouth. Always discard the empty capsule out of reach of a young child. If you have questions or you're unsure about how best to administer ALKINDI Sprinkle to your child, whatever their age, you must always consult your doctor or healthcare professional. If there are side effects with ALKINDI Sprinkle, please report these to the FDA.
ALKINDI Sprinkle is a prescription medicine used in children from birth to less than 17 years old as replacement therapy when the adrenal gland is not making enough cortisol. Important safety information. Always give ALKINDI Sprinkle exactly as your doctor has directed. Do not take ALKINDI Sprinkle if you are allergic to hydrocortisone or any of its other ingredients. Adrenal crisis. Giving too low a dose or stopping medication can cause low levels of cortisol, which can result in serious illness or death. Treatment with intravenous hydrocortisone should be started immediately. When switching from another type of hydrocortisone to ALKINDI Sprinkle, watch your child closely for any changes. If your child doesn't get the entire dose of ALKINDI Sprinkle because of vomiting or spitting some granules out, contact your doctor to see if another dose is needed. Immunosuppression and increased risk of infection with use of a dosage greater than replacement. Use of a greater than replacement dosage can suppress the immune system and increase the risks of new infections or exacerbation of latent infections with any pathogen, including viral, bacterial, fungal, protozoan, or helminthic infections. Monitor patients for signs and symptoms of infections. Growth retardation. The long-term use of corticosteroids in high doses may cause growth retardation in children. Decrease in bone density. Corticosteroids can affect your child's bone growth and strength. Cushing's syndrome due to high doses of corticosteroids. Treatment with high doses of corticosteroids can cause Cushing's syndrome. Treatment should be limited to the smallest dose required and your child's growth and development monitored appropriately. Changes in vision. Tell your doctor if your child has blurred vision or other vision problems during treatment with ALKINDI SPRINKLE. Psychiatric changes. Corticosteroids can change your child's behavior or mood. Tell your doctor if your child has periods of extreme happiness, extreme sadness, hallucinations, or depression. Gastrointestinal reactions. Tell the doctor if your child has stomach pain, upset stomach, black tarry stools, or vomiting of blood. These could be signs of ulcers or tears in the stomach or intestines. Taking anti-inflammatory nonsteroidal drugs like ibuprofen, naproxen, or aspirin can increase the risk of ulcers or tears. The most common side effects of ALKINDI SPRINKLE include retaining fluids, changes in glucose tolerance, high blood pressure, behavioral and mood changes, greater appetite, and weight gain. Vaccination. Administration of live vaccines may be acceptable in ALKINDI SPRINKLE-treated pediatric patients with adrenocortical insufficiency who receive replacement corticosteroids. Please visit alkindisprinkle.com/patient for more information. You are encouraged to report negative side effects of prescription drugs by contacting Eton Pharmaceuticals Incorporated at 1-855-224-0233 or the U.S. Food and Drug Administration, FDA, at www.fda.gov/safety/medwatch or call 1-800-FDA-1088. Please see full prescribing information for more information.